Welcome to HCC. Today I am here with the Chief Operating Officer of Hope and Care for Children Incorporated in Nigeria, Mr. Israel Nyanfor. Welcome, sir.
Thank you, sir.
Good to see you. We would like to look at Nancy Fayia Medical Clinic. The topic is just about its operation and clinical transformation.
I'm Mr. Israel Nyanfor Senior, and I'm the Chief Operating Officer of HCC in Liberia. That's the Hope and Care for Children in Liberia. I'm happy to be part of this great family, and today I'm extremely grateful to be interviewed by the CEO himself to tell the people out there as to what are those things that Nancy Fayia is involved with and how God has blessed we Liberians through Nancy Fayia, and that good things are happening here. So CEO, I'm happy and I'm glad to take all of the questions.
Yeah, it is highly encouraging to note the significant shift in Nancy Fayia Medical Clinic's performance. The recent surge in patient numbers and clinical activity is a testament to your strong leadership, and under yourself as the COO and Yama Benyan, who is the officer in charge, OIC, and a deeply committed staff members. What specific operational leadership strategies you directed Yama in which she has implemented?
So there are three things that I told her about that we think if those things are put into place, the clinic will be the top notch in the top district of Harrisburg. And the first thing I told her was to do with accountability. And in every patient that comes to the clinic, to know what they are charged to pay. The nurses will go to you immediately, welcome you at the clinic, and then after you have been welcomed, what they will do also is to examine you, go through all of the processes, everything. While you are going through your treatment and things, then of course they can pay your bill on you. Unlike other areas, which I would not want to call name for professional reasons, if you don't deposit a specific amount, you won't be catered to. And this is one of the serious problems we are faced with in Liberia. People that are in critical needs, they go to the hospital or clinic, doctor, nurse will tell them you have to deposit this amount of money before we care for you. But here at Nancy Fayia, by the time you appear at the center, we welcome you immediately, and then your process starts. And going forward, we can put the bill on you. So the issue of giving account on everything that is happening, welcoming patients, and ensuring that all of those patients that are brought at Nancy Fayia are cared for is one of the key things that we are taking into consideration. And because of that, patients are kind of trooping to the facility.
Wow. Why behind the growth? What do you primarily attribute the notable increase in community trust?
Okay. Another thing that you see the inflow of patients at Nancy Fayia is that the ultrasound that is being done for patients that come to Nancy Fayia, it is very rare to see it happen in other facilities. And even at the government facility, there are other few private facilities within the suburb of Harrisburg, where Nancy Fayia is situated. They charge huge sum of money to carry on just one scan. But at Nancy Fayia, we give the minimum, we charge the minimum, which is $5 USD, and the equivalent in Liberian is $1,000. So people feel more comfortable to come there because by the time you come, they do your scanning. If you are a pregnant woman, they carry on your scan, they print out your result and tell you as to the condition of your pregnancy. Another thing also that you see, patients are kind of trooping. Whenever the patient comes to the clinic, the nurses that are here, the midwives that are here, they will have some worship service, devotion with those patients and tell them about Christ. One of the things that many people told me is that even if you don't have any money, you go to Nancy Fayia, the people will still take care of you. And if you just went there and you deliver and your baby don't have clothes, the clinic will give you enough clothing that can take you for 4-5 months. So the issue about new clothing, so all infants, issue about ultrasound at a minimum amount. Because for sure, you pray for the patient, you tell them about Christ and everything that Jesus did for them. So for this reason, even I witnessed on 2 occasions There are people that came from nearby community called Kalfi. That community is hugely dominated by the Muslims. And they come here to take treatment from here. And whenever they come, they tell them about Christ. And they are happy. So those are some of the things. These are the secrets behind this, but many people don't know.
Yeah. Thank you. Thank you so much. And a worthy of mention would be our technician in the ultrasound. Mrs. Israel Nyanfor has been putting her all out there. So I just wanted to bring her up and mention her name before we continue. Wow, it is exceptional that Nancy Fayia Medical Clinic is achieving record high in both ultrasound care and vaginal deliveries. How does this capacity, how does this robust capacity translate into better parental care, more accurate diagnosis?
We've never had the ultrasound at Nancy Fayia. So the first trimester, second and third trimester. If for any reason the baby is not laying very well, they take that your baby is not laying in the right position. So you have to take some exercises that will place the baby in the position that you can deliver freely. Secondly, if the baby is so big that you cannot deliver by yourself, the ultrasound machine will also detect that, and they will tell the pregnant woman that your baby is big, you cannot deliver so freely. So based upon that, Nancy Fayia has established a relationship and a referral pathway with the biggest referral hospital in Nigeria, that's the John F. Kennedy Hospital. So whenever the ultrasound technician carry on the scan and it is being diagnosed that that baby mother cannot put to birth by herself, then of course they refer to GFK to carry on the C-section. And even if you can put the birth freely, but there will be complications at the end of the day. They will also tell you, and based upon that, they can make a referral. Because Nancy Fayia is just a clinic. They don't have the capacity to run as a full health center or hospital. Based upon that, they have their limitation. So where the limitation ends, then they refer. And thankfully, the nurses that are here, the midwife and everybody that are here, also they are all government trained staff. They were trained by the government, and so they have vast experience when it comes to how to manage this situation and things. But all in all, the ultrasound has been so helpful because of the work that the nurses are involved with and how robust the ultrasound reports are always coming out and think. People would rather prefer to come to Nancy Fayia to carry on their ultrasound scan to see as to determine the fate of their unborn child.
Right. Wow. Thank you very much for highlighting all those positive growth. Now we want to talk about where we are going, because what inspires me is that there's been so much positivity here at Nancy Fayia Medical Clinic, and a lot of people, like you said, are coming from Muslim communities, and they find the love to come here, and they find the warmth. As we look to more outreach programs, what are the primary operational requirements and resources needed to support this extension?
If you do your survey within the suburb of Harrisburg, there hasn't been any clinic that is involved into outreach. The issue of outreach is very important. Many a times people overlook it. And thankfully for Nancy Fayia, we have, from the operational angle, we have two methods of outreach. The first method is the spiritual arm, and the second method is the health arm of outreach. Now, on the spiritual arm, we are going in a community to tell people about Christ and how Christ is the biggest healer. And while we are doing so, we are also going in the very community, especially those communities, because what we're interested to know there is that many people are afraid to go to the hospital. The fear of they don't have money, and because other facilities who all want to live have charges on attending to medical care, so they would rather prefer to take home treatment. And it is the home treatment that is killing most people in Liberia. Especially the government now through Ministry of Health is actually against home delivery. So our goal of going out our primary concern of going out is to spread the message and to tell those that are pregnant, those that are sick, to always go to the health facility for treatment and not to take home treatment. Because even if you're taking the home treatment, the drugs, people that are trading the drugs, the medicine in the pockets, won't tell you the kind of treatment, the level of treatment you will take. And sometimes you will underdose yourself or you overdose yourself. All those things have serious effect on you as the patient or as the sick person. Right. So when we are going out, will be the first phase of the ORC and her team going out. What they will be going to do is to just go in neighboring area around the clinic and encourage them to come to Nancy Fayia to receive treatment. And then the second phase now, we are not going to move around the vicinity of the clinic, but rather we are going in the village, the neighboring villages around. And if they are going also, they will need to carry some first aid material, because if you go to do a medical outreach and you see this person is shivering, you have to do their malaria test, you have to carry some ORS, you have to carry other medication. I'm not a medical person, so I won't be able to tell you those that will be carrying, but I mean, it's a full package. Yes. They will be carrying along. So as they spread the news of the clinic, as they carry the news to the people about what we are involved with, everything, they will carry on some first aid. That aspect is the core component of mental health. Because at that point in time, the measure is against pregnant women staying home and giving birth. Because during that time, there can be a lot of complications. So they are going to tell them why is it important for them to come to the clinic to take treatment from the very day they have gotten pregnant up to the day they were conceived. So we are going to tell them, say, look, it is important to always visit the hospital whenever you are sick. It's important to always visit the hospital during your first ANC. Always have a routine ANC visit. And if we do those things, the death rate for newborn and the mother will actually reduce. And this is one of the highest things on the pig in Liberia. There are a lot of facilities now every day. If 2 persons deliver at a facility, out of that 2, so now 1 person will die. We treat and God heals. Right. So the brain behind Nancy Fayia is just God. By the time the woman goes into the labor ward to give birth, the nurses and the midwife will pray. Right after the prayer, we start the process. And by the time the child is put to birth, they also go on prayer and they commit everything into God's hand.
And we are trusting Jesus here. And that is what is happening there, the fruits of such faith, the fruits of such trust. I personally have witnessed all of this that you have spoken about, and I'm very happy. It is a place where we have a team who trust the Lord, and they do everything out of that motivation.
ACO has been so helpful for ACC in Liberia, and because of the help that we have received over the years, this is why all the testimony are coming. When you just watch the number of delivery that was done, so we want to say thanks to our partner out there, the clothing that they normally send to us through the container normally received of a grant. This is why you see most patients are now coming to the facility, because they believe that by the time they give birth, they will be given new clothing for their children, and they won't have the time again to go to buy clothing for their children.
Yeah, and you said that can take them for at least some months.
Just some months. Yeah. And another thing also here is our staff that at the clinic, they are very loving. They encourage the patient, they talk to them in a bold, humble, and respectful manner. As a matter of fact, if a patient comes to the clinic for treatment, the reason why they come to the clinic is because they're not well. Yeah. Some people don't need medication before they get well. That kind words heals them.
That's true.
Just prayer alone heals them. And that is the strength of Nancy Fayia. The kind words, the prayers, and all of those gifts that we give to our patient, it revives their soul. It even makes them to even feel like we are home. So I want to say thanks to everybody for the support. And we pray that God will bless all of those that have chipped in one way or the other to put smile on the faces of the Liberians. It is not easy, but in all, we give God glory for everything that God has done and those ones that He will do. I want to say thank you to the ACO team, thanks to the ACC team for the level of work thus far. And once again, thank you so much.
Thank you. Yes. And I do not have any more to say. I come behind all those words of thanks. God bless you.
Thank you.